Thank you, Speaker. My question is for the Minister of Health. Minister, last week I toured the Collingwood General Marine Hospital to check on the dialysis unit, which, as you know, has a waiting list of 8 patients. Because of your government's delay in approving the funding, patients now have to travel either to Barrie or Orillia for this life-saving treatment. But while touring the hospital, I learned of even a greater crisis. The hospital is bursting at the seams. Even if you help to eliminate some of the current backlog by approving the funding, if any further patients come along, there will be no room to provide them with dialysis services locally. The hospital has had a capital expansion application into your ministry since 2004, but you've ignored them for 7 years. Minister, why have you overlooked the needs of patients in southern Georgian Bay who rely on the Collingwood Hospital?
Well, thank you, Speaker, and I am more than happy to talk about what we have done to improve healthcare infrastructure in this province. Speaker, the reality is, when we came to office in 2003, we inherited an extraordinary deficit in our hospital infrastructure. So we rolled up our sleeves, Speaker, and we went to work, and we have built now 18 brand new hospitals, Speaker, 18 brand new hospitals, and we have embarked on major capital projects and 100 more, Speaker. So our commitment to improving the infrastructure is undeniable, and the evidence is in the hospitals that are opening right across this province. Hear, hear. Speaker, is there more to do? Yes, there is more to do. We've made a significant dent in that infrastructure deficit, but there is more to do, and we are determined to come back to this House and continue to improve infrastructure.
You guys left a mess.
Commentary.
Well, Minister, your government had no problem approving a remodel of the CEO's office at the Central West Community Care Access Centre into an executive suite that cost taxpayers $400,000. You have no problem spending money on bureaucracy, but turn to patient care and you're broke. Patients in Collingwood are lying in the hallway. Administrative offices at CCACs and LHINs have no hemodialysis machines, they don't perform any surgeries, and they can't take your blood or repair a broken arm. If you don't act quickly, there'll be no additional access to dialysis services in Collingwood. The hospital needs your approval so they can get going on building a new wing for ambulatory care and dialysis, which would also allow them to expand the emergency room. Minister, when will you be approving the expansion of Collingwood General and Marine Hospital?
Speaker, this is simply an astonishing question coming from this particular member of the opposition. This member was the Minister of Health, Speaker. He was the one who got the Hospital Restructuring Commission rolling. He's the one who's responsible for the closure of 28 hospitals, Speaker. Let me look at the record of this particular riding, Speaker. The Stevenson Memorial Hospital, Speaker, they had their budget cut by almost 6%. That hurt families, Speaker. The General Marine Hospital in Collingwood, they cut almost 10% from the hospital budget there, Speaker. In stark contrast, we have been investing more and more in the hospitals right across this province. At Stevenson Memorial, it's 34% more, Speaker. Collingwood, 45% increase in spending. We are committed to continue improving. They want to cut health care, and there is no way you can cut health care and improve services, Speaker. We are on the side of the patients of this province.